The Skincare Through the Ages series is sponsored by Neutrogena. To learn more about the products mentioned in the episodes, please visit the link in the description.
Hi, I'm Dr. Patti Farris. I'm a board-certified dermatologist, and I am your host for this episode of the Science of Skin podcast, formerly known as Skincare Confidential. I'm really excited today to be joined by two of my girlfriends, but also two very well-respected dermatologists. I'm going to read both of their bios, and I'm going to start with Dr. Mona Gohara. She completed her residency in dermatology training at Yale, served as chief resident, and is now a clinical professor and associate director of community engagement and practices in New Haven, Connecticut. She's a leading advocate for skin health, education, diversity, equity, and inclusion in dermatology. Yes, she is. She lectures nationally and internationally, writes for the mainstream media, and partners with professional societies and industry to advance the representation in the field. She served as president of the Women's Derm Society. She's widely published. And I did not know you sat on the editorial advisory board for all these publications. Very cool. Elle, Women's Health, Shape Prevention, and Good Housekeeping. Outside of medicine, she and her husband have a lovely home in Connecticut and two teenage sons, which I know keep you busy. Both of you guys have boys.
I
What's
know,
up
we're
with
boy
that?
moms.
You're boy moms. I love that. I always wished I was a boy mom. I had three girls, but I'm such a tomboy. I'm like, what a waste. All right. So for Kavita Mariwalla, she's double board certified in dermatology, as well as she's a cutaneous oncologist. She's a Mohs surgeon. She did her undergraduate and medical school and residency and fellowship training at Yale. Is that where you two met?
Yes.
Ah, the plot thickens here. After leaving New Haven, she served on the faculty at Columbia as director of cutaneous oncology and then at Stony Brook University. In 2011, she founded her private practice, Mariwalla Dermatology, on Long Island. She's widely published in the medical literature and is the author of several books and book chapters. She's the founder of the series 21 at 21, which focuses on teaching derm residents. And I know everybody knows you so well for that. She's also currently serving as president-elect of the ASDS and has three sons that are baseball loving. I love that. So guys, welcome to the Science of Skin podcast. And we have such a great subject. I've been so excited for this because what is having a bigger moment in medicine than menopause? Nothing. It is so big right now. It's big on social media. It's big in medical circles. And we really want to talk on this episode about skincare and how it relates to the perimenopausal and the menopausal patient. So maybe starting with you, Kavita, what are you seeing in your practice? Are more women coming in with, in this age range and this time of life looking for advice from you? And like, what things are they complaining about?
I think for me, this menopausal topic is one that hits home because when you start going through it, there's no mistaking that something is off, right? Forget just the night sweats. It's like the brain fog. Your stomach isn't quite the way it used to be. You feel like some days you feel totally fine, like yourself, and some days it's just cranktasticville. And it's real, it really makes you feel like what's going on in the world. And then you feel like someday you just wake up and you're old. And that's what my patients say. Like, I don't know what's happening to me, but suddenly I just feel like I'm old. And they all do this grasping motion of their face like that. Like you just feel like everything has fallen and it's not going the right way. And there's hair loss. So I think a lot of us end up putting everything in the bucket of perimenopause and menopause, but at the same time, it's like we don't put enough in the bucket of perimenopause and menopause because we blame it for things, yet patients don't know what to do to try to combat it, which is why I'm so excited to be on this podcast with two of my favorite women ever. So I see it a lot. People come in complaining a lot of the symptoms and asking, what can I do?
Of course. Go ahead, Mona.
Yeah. So first of all, thank you so much for having me, Patty. This is so exciting.
Having you.
So I definitely see women coming in every single day who are my age. I just turned 50, so I'm kind of going through it with them. That makes it better. Common concerns, but I don't know if it makes it better, but at least we understand each other. But, common concerns include dryness, dullness, sensitivity, loss of firmness. Many also are experiencing breakouts. They're like, what the heck is going on? My teenagers having breakouts. Why am I here? Breakouts. Hyperpigmentation is huge, especially with the whole advent of hormone replacement therapy. There's a lot of hyperpigmentation. So to me, it becomes perimenopause and menopause really has become a time of skin recalibration for my patients. They kind of have to figure it all out again.
Oh, I love that. Skin recalibration. Let's talk
Yeah.
about skincare, because this is part of our Neutrogena takeover. And of course, they've really trailblazed through this with all the research they've done. What do you do when these patients come in? What types of things are you recommending?
For me in my practice, I like to go back to a lot of basics. I think that we don't, as much as everybody wants to be on a retinol, like they're not on a retinol really in their 30s and 40s. They sort of start to figure it out as they see the changes. For some, by the time you see changes, it's like you're playing a game of catch up. Um, so I like to make sure that they're using sunscreen. I like to make sure that they are using something that's a retinol or a retinoid. I have my sort of sleeper secret in the drugstore is Neutrogena Rapid Wrinkle Repair. I make no secret of that. I love it. But the reason I love it is because when you get to know how it's formulated, it's incredible that it's at that price point and in the drugstore. Retinols, Patty, I don't need to tell it to you, but they're very unstable in formulation. And by the time a jar is on the shelf, you don't really know, was it sitting there, to just get delivered 2 months ago? Or is that the product that in your particular store has been sitting there for 4 months? And it's really important that that retinol is stable, that when you apply it, it actually disperses into the skin and doesn't just sit on the surface to cause all the irritation and none of the advantage. And one of the things about rapid wrinkle repair is the way that Neutrogena stabilizes their retinol through the entire production process. And that's incredible to me. So what's in the jar is really high quality ingredient that's stable and does not cause a lot of irritation. It's really hard to make that at that price point. So I love that as a basic beginner. I tell my patients to make sure they're using some kind of antioxidant. And then I'm a big fan of peptides. You kind of have to do that 1-2 combination when you're going through this perimenopause, menopausal state. And I know we'll get into it. We'll talk about these topical estrogens, whether we believe them, whether they're doing the things. But, really collagen production decreases so much at this age that we really need to try to, supplement it.
Yeah, I think that's so true. And you make a good point about the formulations. One of the things I love about Neutrogena Rapid Wrinkle Repair is they have the concentration of retinol on the bottle. Very few products actually have that. They also have multiple formulations you can use, the creams, you can use the oils. I mean, there's different formulas of it too. And you make a good point about the stabilization. That's so important. We all know that. And I think retinols. So maybe a question for you, Mona, is retinol still the gold standard? I mean, yes, we have peptides, we have growth factors, we have secretome products, we have exosomes, we've got ingredients galore, but retinoids in the eyes of the dermatologist are still the gold standard. And why do you think that is?
I think it's very simple. I think it's because they're backed by decades of science.
Right.
I mean, they're not one-hit wonders, right? They're not,
I love
they
that.
are bad. They have withstood the test of time. They
Good.
increase skin cell turnover. They boost collagen. They even out skin tone. I mean, if I always joke around with my patients, if my house was burning down, I'd grab my husband, my kids, my dogs, and my retinoid and I'd go. Right. Because, and nothing else checks all those boxes. I would love to hear from you two, esteemed dermatologists, if you can think of one ingredient that checks all those boxes and is backed by so much science. And I just love the fact that now it's evolved. It's kind of like the iPhone, like it's evolved so much that you can find it, specifically like you all have talked about in different formulations, in different concentrations. And I love that you can find it here with Neutrogena, different price points that's accessible to everybody. So for me, the simple answer is it's science. It has the science and it withstood the test of time.
I agree 100%. I'm going to hit one study, and this really speaks to the commitment that Neutrogena has to retinols. We published in 2024 an integrated analysis of 6 studies, and this integrated analysis looked at various parameters of photoaging, including wrinkles and crow's feet and uneven pigmentation and overall photo damage as well. The patients were 30 years old and over. They had to have mild to moderate photo aging. And they combined all 6 of these studies. There was over 350 patients. Many of the studies are split face. So it ends up that, there were 234 subjects in the vehicle and 237 in the retinol group. Of course, some of them serve as their own control in a vehicle controlled study. But basically what they found was as early as 4 weeks using Neutrogena, 0.1% stabilized retinol. Patients started seeing statistically significant improvement over the vehicle control. And that's 4 weeks. And then, of course, it got better over time. The studies were all 12-week studies, except one, I think, was an 8-week study. But the nice thing about doing this integrated analysis is we have what is really the largest cohort of patients ever to be examined and ever to be, I think, published, at least it was when we published it in 2024, that used a retinol. We have tons of research on tretinoin, and as you guys know, that was more my era than yours. But they were publishing in the 90s tons of studies, big studies and good studies, because it was prescription, right?
Yeah.
But they made a huge commitment here with these 6 studies, all vehicle controlled, all double blinded, and actually they were done by the same investigator over a period of time. So there's a lot of consistency here. Obviously, integrated analyses can have some weaknesses because you are putting different studies together. But these were all very similar studies. And, the data is just so strong here. And this was looking at wrinkles on the forehead, looking at periorbital wrinkles, looking at cheek wrinkles, uneven pigmentation, brown spots, and overall photo aging. So such a great study. I loved when they published this. It was a labor of love because it was a lot of work to get it published. But it really, I think, adds significantly to the literature. The other
And I
thing
think
that
it's like,
go ahead, Kavita.
and Patty, to your point, like it's incredible that an over-the-counter brand would foray into a double-blind scientific paper, right? And the thing that I loved about that work is that it was done over 12 weeks because so much of what we'll see in these sort of white papers or offshoots that are not actually through peer-reviewed journals, so this is peer-reviewed, it got into the literature, is these like 4-week studies, 6-week studies. Well, in 4 and 6 weeks, what are you really seeing? You're seeing a little bit of just moisturization, like the
Yeah.
benefits of using something, the benefits of having a routine. So 12 weeks is really where, the truth comes out. And I loved that study because it felt like there was such good data that we don't see over the counter companies really engaging in.
Yeah.
Right.
I
And I
agree.
think to me too, it really speaks to their commitment to accessibility, right? Like
Exactly.
wanting consumers and our patients to have access to scientifically backed and efficacious products that are, accessible to everybody. And I appreciate that.
I agree. I love
And
that democratization, as we
yeah,
call
the
it.
democratization is so important. I was at a dinner a year ago, and it was a government program funding thing for the Women's Health Initiative, and the line that always stuck with me is that half of the world is going to go through menopause. And yet, like, here we are. How do we not have more programs, like more education about this? And to be able to actually tell women, look, let's start here. This is the first thing to put in the bucket for your skincare and these skin concerns. You can get it at the drugstore. To me, is such a win.
Yeah, that's a very good point.
The Skincare Through the Ages series is sponsored by Neutrogena. For over 90 years, Neutrogena has advanced skin health for all skin types. With formulation expertise that combines scientifically proven ingredients and innovative technologies to deliver maximum efficacy and an unparalleled aesthetics experience. That's beauty to a science. To learn more about the products mentioned in the episodes, please visit the link in the description.
I'm curious from you guys, because I know you see a lot of patients with skin of color. How do you deal with retinoids in patients with skin of color? Do you feel comfortable with the Neutrogena rapid wrinkle repair in this population?
Oh,
So I think
absolutely. Yeah. I mean, I certainly feel like very comfortable. I think everybody's individual. Everybody has different skin types and skin nuances and routines, etc. But in terms of the science and in terms of so it's like, for me, it's like efficacy and elegance, cosmetic elegance. Is it efficacious? And if those two things, and the other E for me is everybody, right? Can everybody use it? And if I can check all those boxes, then it's a product I recommend to my patients. And this one does. I have zero issue recommending this to patients of all skin types and tones.
Okay. Love
I'm
that.
somebody who's pretty intolerant of retinoids. And whenever I say that, people be like, oh, have you tried this? Have you tried that? I'm like, okay, guys, like I am a dermatologist. I know I use a retinoid, but
Yes,
my
I have.
skin just, it gets very irritated. The Neutrogena Rapid Wrinkle, I have no problem with. And for those who are worried about it, actually Neutrogena has gone back and done some really interesting work on this idea of whether a moisturizer is going to impact your efficacy of your retinol. And it turns out they did it with their Hydra Boost line, which I also love very much. And speaking of boy moms, I've got my boys using it and they love it very much. But if you do something we call kind of open face sandwich. So on social media, people will say, oh, you can put a moisturizer, you put your retinol, then you do another moisturizer. We don't want people doing that anymore. We really want them to decide which way is their sandwich going to go. You get one piece of bread, and that bread is Hydro Boost water cream or water gel, and then you've got your retinol. So you can do the moisturizer first, and then the retinol, or the retinol and then a moisturizer, but we're not layering it in between. And it turns out that it does not change the efficacy of the retinol. And for those who might even be sensitive with the rapid wrinkle, it will still allow you to use it without any issue with tolerability. And for those who are listening, remember in brown skin, anything that makes it turn red will be darker brown afterwards. So it's really important for us to make sure everything is really just very calming and soothing rather than irritating.
That's such a great point because you can so prone to hyperpigmentation.
Yeah.
Right. Well, especially in this age range.
Yeah, absolutely. You touched on HRT earlier. So many women are on hormones now. We've got a whole resurgence of that and acceptance of it again. Thank goodness for the studies that came out. But
Yeah.
you did mention that hyperpigmentation is a huge problem in these patients. And sometimes you do see it in patients with HRT. So how do you approach those patients in terms of sun protection?
Yeah, I mean, for me, daily diligent SPF indoors and outdoors is absolutely everything. And we know that that's a hard concept to grasp. I mean, like, behind me, it's freezing outside. It's cold, it's gloomy. People are like, what in the
What are you
HE double
telling
hockey
me?
sticks are you talking about? Telling me I need to wear sunscreen. But we need to kind of like, shift the paradigm to think about it as light screen. For me, it needs to be light screen. So if there's light, you need to wear it. It's not just about the sun. And so kind of shifting that paradigm to really educate our patients around the fact that sunscreen and SPF is actually, a medical, it's a treatment. It's not just protection. It's actually a treatment to help with hyperpigmentation. And I really like products that are, you brought up, Patty, that don't leave that white, awful cast,
Yes,
especially in brown skin. So the Ultra Sheer Mineral Face Liquid SPF from Neutrogena is
right.
awesome because it's sheer. It goes on. And you don't have to have your patients compromise. Again, the word I keep using is efficacy for elegance, so they feel comfortable using it. I always joke around with my patients that you have to have like an anti-Tinder approach to sunscreen. You can't just grab the first sunscreen that looks good or smells good. Or else the relationship ain't gonna last. You need to have a sunscreen that is like you're gonna, have a long-term relationship with. So get to know it, and this is
Oh
one that's
my
great.
gosh, that's so funny. I love
I
that.
also tell people, I mean, yes, the Tinder sunscreen or the Tinder light screen, I think is definitely
Yeah,
has to be the
yeah,
motto. But I tell people the same thing. I'm like, if you can see and it's daylight, you need to have
yeah,
sunscreen on. But the thing
right.
that a lot of people get confused about is that they think of sunscreen having to be something different than moisturizer. So they'll say, oh, my moisturizer's got sunscreen in it. And I always say, why don't
Yeah,
we
yeah.
think of it the other way? Your sunscreen has moisturizer in it. So use the sunscreen instead of doing extra steps. Because the other thing about perimenopause and menopause, right, is that by the time you get into it, you're a busy person at that point in your life. And
Exactly.
you
Yeah,
don't
probably
need
the
other
busiest.
things taking extra time. Like I'm sitting here chatting with you guys in a car parked while my son's doing a school interview. Like how many things can you do at once? So you don't need extra. I love sunscreen as a moisturizer. There's nothing to say that sunscreen can't be your moisturizer. So skip a step and, do the treatment.
Yep.
That's such a good point. Such a great point. We've touched a little bit on Hydro Boost, and I want to mention another thing that I think Neutrogena did, which again sets them apart a little bit from the rest of the consumer companies. We all know, like the dispensing companies, the doctor brands are testing their products all the time with procedures. But Neutrogena actually did a study, and actually Ted Lane, who you guys know is my co-host on this podcast and my partner at the summit,
He didn't come
did a
on for the
study.
menopause podcast.
Yeah, no, I gave him, he's doing men's skincare, okay, where he belongs. Listen, he's living with a menopausal woman, okay? So, he's all about menopause. He's all about menopause right now.
Poor guy. We should send him flowers, actually.
We really should. We really should. He said something to me not long ago. I said, I'm sorry, Ted. It's just the way it is, honey.
Just get through it,
It's
brother.
just the way it is. He's like my baby brother. He's me. I love him. But he actually tested a little Hydro Boost regimen in patients who were getting non-ablative laser resurfacing. And I love this because, again, we talked about democratization, not having to go buy some uber expensive moisturizer and cleanser to use after you have your little in-office procedure. And he looked at the Hydro Boost gel cleanser, which is fragrance free, and they use that twice a day. And then he looked at the Hydro Boost water cream, which you mentioned, and that's a really nice moisturizing Hydro Boost product. And they also use the Ultra Sheer Mineral Face Liquid Sunscreen. And what they did, and it was a small study, but what they wanted to do really was just assess tolerability and see if the patients liked it. These were patients who had had procedures before. And basically at the end, the takeaway was it was very well tolerated. They used it immediately post-procedure and for 2 weeks after. And that the patients really felt they had less erythema, they had less downtime, they had less stinging and burning, and they had a great post-procedure experience. So this, again, is a really nice on-the-shelf option for us to look and turn to, because these procedures aren't inexpensive, as we know. So it's nice to be able to have something OTC that we can recommend that's actually been looked at with procedures. So I know you guys are doing procedures on these patients.
Yeah, I mean, I also think, to Kavita's point, this is another great instance of like the multitasker. Like, people come in and get these procedures. Nobody has, and life goes on, right? Life doesn't stop because you just had a procedure, and nobody wants to leave the house looking like, they can fry an egg on their face with all these like barrier creams and everything when they leave. They have things to do. They're in public eye. And so a cosmetically elegant option that is good for your skin anyway, and has these potentially reparative benefits, to me is a win-win.
Agreed.
I couldn't agree more. And especially, not just post-procedure, but like sometimes post-procedure, what happens is people are such good rule followers that they give themselves milia or clogged pores or acne with the emollients that they're using to heal their skin. So you go from one thing that you're trying to fix to now having to undo what you did in the healing phase. And I found that the Hydro Boost doesn't do that. And it's also great for long-term aftercare. So that the patient's not going to break out in acne, or if they have acneic skin, they need something that's gentle, that's going to get them through that little, flare. And so I use it as a go-to moisturizer all the time, not just post-procedure, but I have confidence in it that after whatever we're doing, it's not going to mess up the results, which is the key thing, right? Like you can't have people go home and mess it up.
Right. And it would be interesting to see if actually it in some ways may enhance the results a little bit. That would be a nice kind of next step to this. Is it not just, helping post-procedure, but is it actually enhancing post-procedure?
Yeah. So I'm so glad you brought that up, Mona, because we use it a lot after intense pulse light, which again, normally you don't think of post-procedure care after something that's not breaking the skin, right? So intense pulse light, we pass it over the face. You do it a lot for red, for brown. It doesn't interfere with the skin barrier. But we know that erythema, or that redness, can be brought on by just simple skin irritation at the microscopic level. So we have people use Hydro Boost for a solid month after intense pulse light, and we are finding that recovery is better, and they really are able to extend how long they need in between treatments. Like they actually look a bit better after one treatment than if they had just gone to whatever skincare routine they were using before. So anecdotally, I can tell you that at least even in procedures that you wouldn't associate with needing post-care, it's a really good additive.
Excellent. That's great.
That makes total sense. So we have to talk a little bit about hormones and this
Mhm.
whole estrogen skin cream craze.
Yep. Got to
Um,
talk about it.
Got to talk about it. I'll throw it to you all to maybe tease it out a little bit. What do you think about this? Do we have enough studies to report or to suggest it to our patients to support the use of topical estrogens?
Well, I'm not there yet. I'm just going to be honest. I'm not at the I mean, I know that we have, there's a lot of data about topical estrogens down there. I don't know what term to use, on your podcast,
Right.
Patty, but you know what I'm saying, it's plumping, it's firming, it's
Yes.
rejuvenating but I just don't think that we're there yet on the face. Or would we induce melasma, for example? What are
Right.
we, what are the side effects? I'm sure there's benefit. I'm sure there's some type of benefit. There's no equivocation in my mind about that. I just don't think we've peeled the onion enough to figure out how exactly to use it. What's the right context?
Right.
I think we just need more.
Yeah, I think the thing that made it feel exciting is we know that when estrogen dips, you're hosed on the collagen aspect, right? Like you
Of course.
do need estrogen to have collagen building blocks. So what did the community do? They tried to reverse engineer it. So like, okay, you're not producing it anymore in your body. Can we apply it topically and sort of trick your skin into thinking it's still there? That's the basis of a lot of these topical creams. We do know in breast cancer populations, I'm a breast cancer survivor. I was thrown into menopause in 6 weeks. That was a good time. And,
Yeah,
and
that was
you
fun.
start to
Oh
realize
my
that
gosh.
like what else is out there for me. So there's been a lot of work done on estriol, estriol. They claim now that it is safe to use on the lady parts. It won't make your breast cancer return, and it can be
Mhm.
helpful. But I just want to take a second to talk about the science of it in skincare. Estriol of the three different types of estrogens is the weakest. So it is the weakest signal to your body to help you upregulate or produce more collagen. And to me, you're putting something on a decent sized surface area. Maybe you're using it on the chest, on the neck, on the face. Are you getting systemic absorption? I'm not sure that I know that data. It's one thing to do it on a smaller mucosal surface, but now you do it there. Now you're doing it on your face. You're doing it on your décolleté. You're doing it on your neck. Now I start to get a little bit fuzzy about that. But if you're going to choose an ingredient, am I going to first go for estriol versus a retinoid? Never.
No.
Right? We already know that there's a tried and true. Our husband is out there always getting our back, right? That's your retinoid. The estriol is like something cute to look at. If you want to try it, you can, but there's been a lot of hype about it on the topical skincare that I just am not sure it's as good as what we already know. Now, some people are combining the two. They're like, okay, we're going to add estriol to a retinoid or a retinol, so it's going to be
Interesting.
even better. It's just not that strong. It's the weakest of the three. And
Yeah.
so I think that you have to think about it like, why are they choosing the weakest one? And it's because the other two potentially do have systemic absorption, so you can't risk that. So I'm with Dr. Gohara. I'm not there yet.
Yeah. I think the thing that we said earlier to kind of touch back to retinol does so many things:
Yeah.
epidermal effects, skin
It's your
lightening.
life partner.
It is your life partner. And the thing about retinol is it takes good care of photo age skin, and you can't get all those benefits from an estrogen, topical
That's
estrogen.
right.
I mean, it's
That's
not
right.
going to do all of those things. It may give you some skin hydration. It may help boost some collagen. There was actually an interesting study done years ago in John Voorhees' lab, who you guys know was like one of the preeminent
Yep.
researchers at the time. And he looked at topical estrogens in photo age skin compared to what happened when he put them on sun protected skin, like the hip. And what he found was that they didn't have near the benefits in photo age skin in terms of collagen production. They did it really well in the intrinsically aged skin, but they were less effective in photo age skin. It was a very interesting study. They didn't really speculate as to why that was, but to me, that's a study that I think is worth maybe revisiting, because
Mhm.
there's something inherently different about what happens in photo age skin. As we well know, you have way more oxidative stress. You have lots of different things going on. So I still think that retinoids are a life partner for our faces. Let's put it that way.
I agree. And I think that, in photo age skin, it's really photo damage, right? So as like a
Absolutely.
cutaneous oncologist, I got to put that out there that, the sun that you get in your 20s is going to show up in your 40s and 50s. And so
Right.
people get on the bandwagon a little bit late, and really a retinoid or retinol versus an estrogen is going to help you reverse some of that. An estrogen topically is never going to undo what's happened already.
Yeah.
And I think that's a key thing. And for women who are going through menopause, I mean, the skin, the hair, the GI tract, like there's so many organ systems that are affected by this, that if like we can give you one solution, it's just, go grab a retinol, use some sunscreen, start there. And then, we're here with you on the journey.
Right. Don't complicate.
I
Don't
love it.
complicate.
Thank you for giving me such an early morning time. You guys are amazing. You covered it so well. And I hope this will be a great episode for everybody out there who's perimenopause or menopausal, or even for those who are younger, who at least want a little glimpse as to what's going to happen. So thank you guys again for your expertise. This is going to be amazing. And I hope everybody has a great day. Thank you for joining us at the Science of Skin podcast.
The Skincare Through the Ages series is sponsored by Neutrogena. For over 90 years, Neutrogena has advanced skin health for all skin types. With formulation expertise that combines scientifically proven ingredients and innovative technologies to deliver maximum efficacy and an unparalleled aesthetics experience. That's beauty to a science. To learn more about the products mentioned in the episodes, please visit the link in the description.